are and in um, mental health, more people who are in the sex offender treatment programs. And there are very specific rules and regulations around what a person is or is not allowed to do if they are in that setting. So we asked Natalie Popham to come and to give us the lowdown so that we all understand what is expected. She has multiple handouts, so I will be emailing those to you separately so that the chat does not become overwhelming. We have two interpreters with us today. We have Shannon and Kenya. And just so that we're clear on how we're signing things today, we will be signing probation. And then for parole, be fingers above. Then for probation officer, for sex offender, and then for sex offender treatment program. Okay, and if you want to at the end at Q&A, if we want to talk about conceptually accurate signing, we can do that. But for simplicity's sake, during the presentation, that's how we, with the communication team, agreed to sign things for today. Thank you so much for being here, Natalie. Please educate us.
Okay. My name is Natalie Popham. I have been a probation and parole officer for 8 years, and I've had the sex offender caseload for 7. A lot has changed over the past 8 years as far as the rules and regulations. It's almost a yearly thing that the Senate will put out new bills that they want us to follow regarding the sex offenders and how they're monitored. So one of the handouts that I included is the specialized conditions. And those are what we give them on the date that they start their supervision. So this follows them the entire time that they're on supervision. These conditions will end once their supervision term is up. However, their registry requirements will continue to follow them for the duration of their registry, whether that's 20 years or a lifetime. So one of the things that I want to cover, I don't want to go over all of these conditions because it's a long document. It's 5 pages. So we'll just kind of cover some of the ones that might help with services that could be offered that might limit what they can be offered, and also where they can work. So I know employment was one of the questions that was brought up. And so one of the conditions states that they cannot work or be in charge of, like a supervisor over anyone who would be 18 or younger. They cannot have any position of authority. Schools, churches, youth buses, or bus stops. Boy Scouts, Girl Scouts, or similar organizations. Daycare centers, private babysitting, or any type of childcare. Any religious classes, ministries, choirs for anyone under the age of 18. Any type of sports or leisure activity for anyone under the age of 18. At a park, a playground, or a publicly owned or leased swimming pool or splash pad. Any type of arcade or amusement park. Any establishment whose primary purpose is the sale of alcohol. And again, any position of authority. One of the conditions also states that they have to notify their employer of their current criminal conviction. So whatever their current charge is, they have to make sure their employer is aware of that. And they cannot work for a mobile business. That means like a food truck, ice cream truck, something where the business is mobile, not a mobile phone. That seems to be kind of the confusion we get. That's going to be operated within 1,000 feet of a school, a playground, or a daycare, or the publicly owned swimming pool or splash pad. All of the places that we list that they can't work, so like the schools, parks, playgrounds, swimming pools, and splash pads, they're also just not allowed to visit those at all. So those are also off limits. They can also not go to the theater, and we also discourage them from going to the mall unless they have an accompanying adult. And let's see. So those are kind of the general conditions that we look at that maybe would affect employment. The other conditions that is part of that 5-page handout is strictly regarding computer use. And for this population of our clients, that seems to be the hardest because limiting their phones or videos or internet access really hinders their ability to get interpreters for video chats. And also the part of the agreement for their monitoring software that we can provide is that they have no expectation of privacy. So we have been going back and forth with our legal team about what we can monitor and what we can't monitor, and how do we provide these services with the video chats to these clients while still being in compliance with their conditions of supervision. Let's see. I think that's probably it for the conditions. It's just the hard part of the electronic part of it is whether or not we can monitor, what all we can monitor, and how we monitor them. We have access to everything. Our monitoring software shows us every text they send, every call they make, every photo, every video. It takes a screenshot of their phone every 30 seconds when it's activated and on. Any storage devices that they may have, electronic storage devices like thumb drives, PDAs. They're also not allowed to have a smartphone, not a smartphone, I'm sorry, a smart TV, or any type of like Google Fire Stick, Amazon Fire Stick, the Roku. They can't have any of those devices because we can't monitor them. And so we don't allow them to have them if we can't monitor it. And if their offense was against a minor victim, they cannot be on any type of social networking or chat rooms where minors can be on there, and they can't ask anybody about minors. They can't use the chat rooms to gather information about a minor. And then the SOTP providers can limit even further. Whatever the SOTP provider states as limitations, we're going to follow. We're always going to follow their treatment recommendations. If they want to limit more, but we don't always follow the treatment recommendations if they want to take stuff off. We have to follow our guidelines as well. So one of the other handouts was an electronics and reporting handout, and that is something that I give to the offenders when they first report. And so they should have this piece of paper that explains to them the different types of electronics that they can have and use. And then also the electronic device that we would provide to them, which is considered a safe phone. They do have to pay for that safe phone, and it is $60 a month for unlimited calling and texting. And then the phone itself is $180. The safe phone is nice for most people because we can turn on and off different features of the phone. So for those who would need a video chat, we could turn on the video chat and calls, but we could still limit their monitor or their internet access and what they could look at on the internet. Versus where if they just went out and bought a smartphone at Best Buy, we wouldn't have that ability to limit it as well. The monitoring software is it's $33 per month per device. So if they have a smartphone and a tablet and a laptop, that would be $99 a month to monitor all three of those devices. They do have the option that we call a dumb phone. The dumb phone is just basically the opposite of a smartphone. It's going to be a flip phone, something that doesn't have internet access, can't take photos, doesn't be able to take videos. But for this population, we would have issues with that because they wouldn't have access to their video chats that they need for their interpreters. Okay, and then I think one of the other questions that I got was about residents, which is always the hardest part that we have with anyone finding when they're come out of the institution is finding a good place to reside. So the 1,000-foot rule is something that is always confusing to people. We say it's 1,000 foot as the crow flies, so it's straight line. And it's property line to property line. It doesn't matter if there's a building there, that's how we drive through. That's the measurement that we take from their property line to whatever the school, park, playground, whatever that is. And that is only applicable to those who committed their offense after July 12th of 2006. The big thing is that it's always crime commission date, not conviction date. And then I also included the new Senate bill that just went into effect. And that went into effect July 1st of this year, 2023. And that changed some of the rules. So it's something we're still working with to help get them to figure out. And that included the mobile business, where they can't work for any type of mobile business. They can't work for a business that would take them into a school property. They also couldn't work for like a construction company that does remodels. So if there's a resident family and they were to move into the to go into the residence while the family is there to do like a remodel, that's a no-go. They couldn't do that either. And then the other two I handed out were they're just the KRSs that state who is subject to supervision after they're released from the institution, and whether or not they can have probation, and then also have a post-incarceration supervision. The post-incarceration supervision is served after all of their other time is done. So some people get confused because they think they serve out their sentence, but then they have another 5 years of supervision on top of that. I think that's really all I have as far as just my spiel. So I guess if we want to open it up for questions.
Thanks, Natalie. That's a lot of information in a short amount of time. So Holly, why don't you turn on your camera and you can go ahead and ask your questions. If people have questions, we can go ahead and turn on cameras. We don't have so many people on here that it's going to get overwhelming.
Trying to see the question.
So I'm reading in the question, Holly's question is, if they complete registration, then does the list of rules apply to them? You mentioned it doesn't, but when and where does it end? I don't understand. Okay, go ahead.
The specialized conditions end whenever their supervision term is up. their registration requirements, which is their duty to register form, basically that they are required to register their address. They have so many dates from the date that they move to update their address. That lasts the entirety of their registration period, and that's set by the courts when they're sentenced. So they're either sentenced to a 20-year registration or a lifetime. Anyone who has 2 or more victims is going to have a lifetime registration. The duty to register follows them that whole time. Their specialized conditions, the conditions that we discussed and that I went over, will end once their supervision term ends, and that's going to be the 5 years after their sentence expires.
Lori, do you have a question?
Yeah. So if their probation or parole period is over, so the special conditions are over, does that change their residency practice? Like, does that change where they can live, I guess is what I'm asking.
No, the 1,000-foot rule is applicable to the entirety of their registration. That's also on their duty to register form. I should have included one of those. But it attaches to their registration, so it would have somebody's name on it for me to print it.
Gotcha.
But yeah, so the 1,000-foot rule is for the entirety of their registration period, not just their supervision period.
Right, we have 2 hours scheduled and we're 20 minutes in. So if people have more questions, please pop in. I thought there were lots of burning questions.
Let's see. I can look at the questions you sent me and answer those a little directly.
That'd be great. If you want to just go through those questions specifically.
Yeah. So the first one that you sent said, what is the restriction on employment, such as how many feet away from location where children are located? So the employment restrictions that we put are the mobile businesses. They can't have a mobile business within 1,000 feet of a school. And like I said, that just came into effect on July 1st of this year. So it's a new rule that we're still figuring out how to really enforce it. They cannot work for a school or on school properties. Now, this only applies to schools that would have juveniles, so high school and under. Any post-secondary education does not count.
Natalie, I'm seeing a question in the chat from Jules. What about technology while registered or on probation, such as social media?
So we limit their social media while they're on probation. And that's the social media use, like Snapchats, things like that. We tell them not to. But there actually was a handed down by the Supreme Court that we can't tell them they can't have social media. We're just going to tell them it's going to be monitored and some things will be blocked, such as minors. But if you actually look at the sign up, whenever you sign up for any of these social media accounts, one of the checks you have to check states, I am not a registered sex offender. So if they're signing up for it, they're lying, stating that they're not a registered sex offender. So they're not supposed to have it, but we're not the people that are going to tell them they can't. As far as that making an account goes, we will tell them while they're on supervision not to use it to do anything or post any pictures or take any pictures.
And then a question from Holly. If a person is lifetime, does the job restrictions continue?
Yes. So that new Senate Bill 80 about the 1,000 foot from the mobile business is a new law. So that's not a condition of their supervision. That's a law that will follow them for the entirety of their registration period.
Okay, you just keep working down that list.
Okay. The next question says, what is the process PO is having to have with employment service providers? So with employment, we have in our office, we call him the REPA, the Reentry Employment Program Administrator. He works with second chance employers to help find employment. The issue we have is if they require interpreters while they're on the job, we don't provide any of those services except for reporting or anything that is related to their supervision. So we can't provide them for employment or even for therapy. That's not the state appointed therapist. And I think all of this is because it's not new, but new to us of having such a larger population that we're working with. It makes it a little harder for us to try to figure out how to find employment and help them find employment if they are looking for it. But our typical process would be to refer them to the REPA for employment assistance.
And Holly made a comment, I think there's confusion because they don't have to report to their PO. So they think restrictions are over.
Yeah, so a lot of time that does happen and they get very confused on that. I think it started last year. We print a duty to register form every time they register, which has all of these restrictions that will follow their registry term with it. Whether they keep that or not, I can't really say because a lot of times they end up throwing their registration away. But when they register, they should get the paper which has their registry on it, and then a second page which has all of the rules that follow their registration period, not just their probation period. Okay. The next question that we had was, how often does a PO need to report from service providers on assigned person? For the sex offender therapy program, it is required that we get a monthly progress report. So we expect a monthly progress report from each service provider. Some of them don't follow that rule, and some of them go above and beyond and give me one after every single meeting. But per our policy, we want one at least once a month. Let's see, Holly, are they the same for all? Referring to the list you give at registration. Yes, the duty to register form is the exact same for every single person who registers. The only thing that changes on the duty to register form is their length of registration. So either the 20-year or the lifetime. And no, I like questions are great. It helps me know what I need to talk about. So let's see. So the next one was, will we get release of information on said person, such as a court order, length of time on probation, and will we be informed when probation ends? If you're referring to the treatment providers, we do provide them with we don't provide them with their court order. The client should have their court order so they could get that to you. We can provide you with the length of time on probation and when their probation term ends. And we can provide the crime story that relates to their offense to help further treatment and make sure that everything's covered that they would need assistance with. Let's see, one more. With reentry job coach, does that stop after probation? Yes, our reentry employment that we have here in our office is strictly for those who are on supervision. It's a grant funded position. A federal grant pays for that one, so we have to follow some guidelines as far as assistance. Wait and see if she's got any more. If we have a lifetime registrant, what are their options for employment? So as far as employment for their lifetime registration, the only thing that's on the duty to register form that's going to follow their registration period is going to be that no 1,000 feet within a school. Now that 1,000 foot within a school only applies to a mobile business. So again, that's a food truck, ice cream truck, anything like that. And if they're, let's say they work in a McDonald's that's 800 feet from a school, that's okay. Because that's not mobile. They don't have assistance from their trained job coach. Kids need training to be aware of. I'm not sure I understand Makai's statement.
This is the interpreter I think I'm trying to clarify. So the kids need training to be aware of, I guess, sex offenders, maybe? Yes, I think that was a yes.
Okay. Yeah, we don't, unfortunately, we don't really offer anything for us about how to recognize if someone is grooming or trying to get children to do something that they're not supposed to. I wish we did, and I would love to offer that if we could, but we don't have anything currently that we offer that would be of assistance. There are things out there that you can handouts, and you can have the CACU detectives. I think they will offer a training.
I'm sorry, the who? The cat?
Sorry, Crimes Against Children Unit, CACU.
Okay. Thank you, Michelle.
Hold on just a second. I'm trying to give people camera access and it looks like they're having trouble.
Makia was asking, can you see me? What I was asking, I stated that about the kids needing to know, or at least understand and be aware of their environment. And a lot of kids, you know, they're so sweet and they're very innocent and or naive about things and saying hi to strangers and, you know, that sort of thing. But I almost feel like we need to have more exposure for them so that they can hear about this instead of just from their parents, because sometimes, you know, parents say, yeah, don't talk to strangers, but then, you know, kids do what they want. So it's almost like we need practice for that. And also something else that I just thought of was, I don't mean to necessarily say this as a scary thing, but it really does happen, not like we saw in a movie, but there is a true story behind a movie. It was called Black Phone. I don't know if anybody ever saw the movie Black Phone.
Yeah.
That movie has a true story behind it. And I think things like that, you know, kids need to know about that. They need to know how to identify, this is odd. Why is this man wanting to, you know, why is he wanting to talk to me? And those kinds of, you know, red flags that come up. I wish that we could educate the kids a little bit better like that. For example, like they do with DARE, the DARE program. So I think there should be something similar to that, but for sex offending.
No, I agree. That would be a wonderful thing that I wish we could add. Some of the schools I know, when I took my kids to school for their orientation, they had a handout to give to the kids about don't talk to people online, don't play games with people online, things of that nature. So I think there's a little bit more awareness. But from supervising this population for such a long time, I can say that actually the stranger danger is the least amount of occurrence of a sexual offense. 90% of the offenders that we have are what we call relative or acquaintance offenders. So it's either someone within their own family or someone who had a position of authority, such as a pastor or a teacher, who committed the offense. So sometimes it's a little harder to explain to them that this person that you think you should be trusting might be the one who isn't the person to trust.
Right. Yeah, I understand. Yeah. Okay,
Um,
thank you.
CACU, so Crimes Against Children is a special division of the Louisville Metro Police Department. And they work solely with children victims. So whenever a crime is done against a child, sexually or violently, then they're the ones who would respond to that. We work with them a lot to help if we feel like a child's in danger. We end up talking to crimes, the CACU unit, and as well as CPS. Yeah, I agree, Jules. That is something that probably makes it a little harder to, they want to be able to trust those and talk to the to adults that are paying them attention. So it makes it harder to know when you can or cannot.
So if we have a client who is having difficulty finding employment with the restrictions, and he or she is still on probation or parole, is there a way that that person can request that REPA person for help in employment? Because that seems to be one of our ongoing issues, that and then language access for that person, either to talk with that REPA person or the employer, how they can access the interpreters.
Yeah. So the REPAs should be in every single office within Jefferson County. So we have dedicated REPAs for each office. So their sole job is to help our population to find employment. We attempt to offer it every single time they report. Especially if we notice they're unemployed, we say, do you want to meet with the REPA? Would you like to talk to him? You want to be on his schedule, or even just hand him the card and be like, here, you call him when you have time. Sometimes they don't do that. We also, I know with the ASL interpreters, we have to go through the specific website to get an interpreter, and it takes time to get one here. So that's a little harder to make sure we get someone. So we always have to schedule that. As far as other languages, we have InterpreTalk, which is just a phone interpreter that we can use immediately anytime that someone reports that might need that sort of interpretation.
Okay, it's good to know that they can request that. We can encourage them to do that. I think, there's some language disfluency, and some people have some deficits in language, even though they speak ASL. And so we get a lot of people that are confused about what those limitations are and what that means for them and what they can and can't do. So this is very, very helpful to have the handouts and the information so that we can direct them. But I think that even sometimes with interpretation, they come back without a good idea of what's happening to them. So
I agree.
This should be very helpful for us moving forward. Thank you.
I can also help if it would help to get you all the contact information for the REPA for our office, and he could maybe assist with getting in touch with the appropriate ones.
That would be great. Yeah.
And we could say what is the issues that some of them are having issues finding employment, what jobs that he has that might fit.
That's great. Thank you.
Seeing in the chat that Holly's saying that there's an issue with people only being given video-based interpreters and not in-person live interpreters.
So when I have my meeting with my client who's on my caseload, we use a live interpreter. That's something that I request and he's requested. So we try to use a live one if it's possible. The only time we used a video one was the interpreter was running late. So she asked to call in and buy a video. So we did that to keep him from waiting. But other than that, I haven't ran into it here personally. But I do know that whenever I got my client, he was the first one we've had in our district. So we had to really do some research to find out how to even get an interpreter available to us for him to be able to report and get all of the information he needed.
This is Michelle. So could you expand on that? Because I think that's most often the case. There might only be like one person in a whole person's career who's
Yeah.
deaf. And so are there any kind of written guidelines for probation and parole officers? Are there any kind of standards of care that you all have to rely on? Or do you just have to
No.
figure it out yourself
I,
when you
I had to figure it out myself. It was a lot of emails with the director and hey, what do I do? And honestly, he reported immediately from prison with no interpreter. And I didn't know what to do. Was like, we communicated through writing on a pad of paper back and forth for that first time so I could learn how to get him the services he needed. It was very much a learning curve of trying to figure it out.
This is Michelle. So I'm reminding everybody on the call that there is a series of town hall meetings that's happening across the state between the administrative office of the courts and our department. And I would highly recommend that you attend at least one of those. And if you can't attend, we have QR codes and you can submit comments written, but they need to know these issues. They need to know that when a person is referred for mental health services, the court system is not doing an adequate job of educating probation and parole folks about how to get an interpreter. Also, if they're mandating treatments, what happens to the language access piece? So now is a really good time to have your perspective shown. I'd encourage interpreters to do that, as well as therapists, folk rehab counselors. The more that they see that come up, then the more that it will be in the plan or possibly in the plan. Makia, the date, if you go onto the Kentucky Commission on the Deaf and Hard of Hearing website, we've created a video log or vlog, and so did Kelly Sanchez from AOC. So you can go onto the Kentucky Commission on the Deaf and Hard of Hearing website, watch those video logs and see the dates of those town hall meetings. The one in Louisville is coming up in November. I think it's November 8th. Thanks, Holly.
Yeah, the SOTP has been the hardest thing that we have been trying to figure out how to get treatment with the level of care that they need, the appropriate level of care. The group, the state will only pay for an interpreter when it's in the group session that is provided by the state. That is from our legal team. That wasn't anything I had a decision in over whether or not that's how that went. And I think we ended up with Dr. Wagner, who would, with my client, and he provided an interpreter for him to be able to attend. Because otherwise it would fall on the client to be able to make sure that they had an interpreter, and that's not really how we want to try to do things.
This is Michelle. So that's illegal to ask the client
Yeah.
to pay for the interpreter.
I don't think it was to pay for it. I think it was to find one that they wanted. And then the provider was going to, I don't know if they were going to pay for it or how that was going to go. But state didn't want to pay for one for a private provider.
Right. And that's the problem we're having with Dr. Wagner now, is that he has retired and he's moved to private practice, and he will not provide an interpreter, which is also illegal, but he somehow is still getting away with it.
This is Makia. Yeah, because I understand what you're saying, but like if the client is paying for it, no, that's that's actually the opposite of how it should be. You are paying the interpreter themselves, because since you don't know sign language, you know what I mean? It's not the deaf person on them to bring communication with them. It's, you know, the individual who's trying to provide the service who is unable to do it in sign language, who needs to provide the language service. So yeah, it's kind of opposite of what everybody thinks.
Yeah. No, I agree. And we tried, you know, to figure out how we need to go about it. But they only want to pay for our program. And I don't know if that's to get more people in our program or what their process is, or if they, because the offender is paying for their treatment if it's outside of the state program through either insurance or out of pocket, just like regular medical care. And I don't know if that's how they look at it, that this is medical care, this is their responsibility to pay for it. I don't know. I don't work on that side.
This is Michelle. Anthony dropped the dates for the still upcoming town hall meetings in the chat. And then I also put in the chat a resource about Kentucky Kids for Safe Touch programs. Jessica had talked about a domestic violence and sexual assault prevention agency she knew of in Iowa that was called the Safe Touch program. There are different ones in Kentucky, but none of them that I know of have been adapted for people who are deaf or hard of hearing. Other questions? And Julie, feel free to turn on your camera if you want to. Hold on just a second. I'm getting a lot of background noise. Hold on just a second, Julie.
Okay.
Can everyone please make sure that they're on mute? Good, thank you. Okay, Julie, go ahead.
Yes, I do have a question. I am a mental health therapist and I work with some clients who are on probation. And I would like to know how much, this is the interpreter clarifying, how much information to tell probation, or how much information, like when does probation, what do they need to know from the therapist? And how much do they need to know from the therapist?
Our biggest thing that we would request is if there's any type of mental health that would affect how we would supervise them. A lot of them have clinical depression, or I have one who is bipolar schizophrenic, and so it makes it very hard to supervise him, because if he's on an up, he's great. If he's on a down, we have a lot of issues with getting him to report and getting him in front of the courts and doing everything we need to do. Also, we run into a lot of self-medicating, which causes problems with their conditions because they're not allowed to use any type of drugs. So I think that mostly if it's going to be something that would really affect how we would move forward with our side of the supervision, the conditions of supervision, that would be something we would ask. We try to maintain their privacy as much as possible. And as long as they're going and doing everything they need to do, there's not much we would really need to know. But if they suddenly stop going, or just you don't hear from them anymore, it might be good to notify the officer of, hey, he's not shown up for the last 3 weeks for all of his appointments, don't know where he is or what he's going on. And then we can help to maybe either get him back into treatment, or figure out what it is going on with him.
Okay. Thank you so much.
Mm-hmm. And then Holly asked about sex education not allowed in schools now. Does this affect any programs we have for children?
Hold on just a second. I want to make sure our interpreter switch is going smoothly.
I don't know about any of the sex education in classes in schools right now. My kids aren't to that age yet, so I haven't had to experience that yet. So I don't know which isn't allowed and what is allowed as far as what they talk.
This
I
is,
couldn't
yeah,
answer that one.
this is Michelle. Senate Bill 150 did severely restrict what education could be provided. No sex education is allowed prior to 6th grade. And if it's after 6th grade, there has to be parental consent. So it's an opt-in versus opt-out. So I know for our department, we had planned, we do a KIP survey, KIP, and we ask students in middle school and high school about their use of drugs and alcohol and their mental health issues. And it's now we can't figure out how we can get that done with Senate Bill 150. So we have to suspend it for a year to figure out how to best do that. All of the risk factors for children who were deaf, hard of hearing, or deafblind were elevated when we did that in 2021. So we're currently working with a social worker at UK to try to do some research with the data and to publish some papers to try to get additional funding for prevention education.
Okay. Is there any other questions, or do you want me to? I think there was 2 left on that list. We can move back to that.
Sure.
Okay. The next question was, will employers require to know about said paroled individuals? If so, what is the requirement for them to let the PO be aware of? So part of the conditions is that they
I'm sorry,
stay-
Natalie,
oh,
can you
sorry.
say that question again? I'm sorry, I think I missed part of it.
Okay. Will employers require to know about the paroled individuals? And if so, what is the requirement for them to let the PO be aware of? So part of their conditions is that they have to inform their employer of their current criminal conviction. The reason being, we want the employer to be aware that if there's any minors who work in the industry, because 16, you can work at 16. Some of them, that's their victim pool. So we want to be made sure that they're aware that, hey, this is something we want to be cognizant of. And then we just have to make sure that whenever they report to us, we ask them, point blank, does your employer know your convictions? Have you told them? And then we go from there. We don't contact a lot of the employers unless it's something we would be concerned about. We don't want to in any way try to hinder them finding employment. And if us calling their employer all the time is probably not the best for their job. So we try not to interfere too much, but we do want to make sure everybody's safe. That is our main concern. And then the last one, suppose we find that a paroled individual is not ready, job ready, due to treatments and needing them to be stabilized before going to work. What is the expectation on that? If they are in sex offender therapy program, we don't require full-time employment until they complete treatment. But we will, if they are not in treatment or they complete their treatment, then we're going to start pushing for them to find employment. As long as they are continuing to search employment or continuing to find adequate housing or continue with their treatment, we will work with them as far as the employment process goes. The first thing we do if they're ready for employment but haven't found it is we start assigning community service. So that tends to get them to find employment because they don't want to work for free. They want to get paid for it. So we're pretty we really want them to complete the treatment first. Their SOTP treatment program is priority one. That's what we want to make sure they get done before we're going to push employment. And Holly said, no matter the level of supervision. Yeah, so the level of supervision for sex offenders is always the same for the most part. They're all going to be considered medium custody or medium supervision. They cannot drop to a low supervision while they're on the registry or while they are on supervision for their sexual offense. So all of them will have that same basic level of supervision of what we call moderate. So they're going to come into their probation officer at least once a month. And if they have other risk factors, then they may be reporting twice a month.
That last part again, if they have
other risk factors, then they may report twice a month. That's all the questions on the list. So if anybody else has anything.
Please feel free to turn on your cameras, or if you're having trouble turning on your camera, let me know. Natalie, I really appreciate how much detail you gave and all the handouts. I think that's really helpful because it's so much for people to know. And if they only encounter one or two folks in the SOTP or in probation and parole, it's hard to remember all the things.
Yeah. It can be a lot. And in fact, the handouts that I gave you all is about a quarter of what I give an offender when they first report. So they are handed a lot of information. We usually spend about an hour and a half to 2 hours going over all of this information on their initial report day to make sure that they understand all of their conditions.
That makes me think about the challenges people may have if they can't read well. And so if they're handed this huge stack of paper and then
I read it all to them.
Do you?
That's me, because I don't want to run into that issue.
It's a lot to remember.
Yeah, we do have that issue where we get clients and they're on probation and they're on the registry and we don't know where they are in the process, but they don't either.
Yeah.
No clue what's happening. And so that is a big issue, I think, with our deaf clients, is that they haven't had adequate language access. They don't read that well with English. A lot of them, maybe on a third grade level, maybe not at all. And so I think that's very important for your officers to know that if they do have a deaf client that our deaf report, that they may need to spend a little extra time on language and understanding using an ASL interpreter to best get that person to understand their limitations and what they're supposed to be staying away from.
Yeah, I agree.
This is Michelle. I almost wonder if there would be a way for the court system to partner so that they could do those papers in ASL. Like, here's this document, and have somebody interpret that document. So somebody could click on it when they needed to look at it again. It's not going to meet everybody's language needs that way, but having that information available in ASL so that they could refer back to it could be a really helpful thing.
Yeah, I agree. And yeah, Holly, it does have a lot of lingo and language in it, which is why I try to read it. And then I ask them if they have questions and break it down a little bit. Can't say that all the officers do that, but we tried our best to make it as simplified as possible so that we have all the understanding they need. And yes, one of the issues with the link, I think, would be we would have some of them aren't allowed access to the internet at all straight out of the gate, which is another problem with the interpreters and having a video chat. interpreter.
So many things to think through.
Yes.
Right. If nobody has any additional questions, then I have somebody joining right now, right as we wrap up. But hi, Amanda. We are actually finishing up. So we're hoping that our recording worked. Do you have any specific questions you want to ask Natalie before we release her? Okay. Well, thank you so much for your time and giving us so much information. We appreciate having a contact too that we can, you may not appreciate it, but we appreciate being
No,
able to
it's
email
great.
you
No, it's fine.
and say, hey, what about this? I think it's so important that we try to increase that access and make sure that people are meeting their requirements. So thank you for all that you're doing and for helping us to do a better job as well.
Yes, no, I agree. And you can email me anytime. If you have any questions or if anybody thinks of any questions after maybe they watch the recording, that we can try to help answer as well.
All right. Thank you, Kenya. Thank you, Shannon. And we hope you all have a good rest of your day. Thank you so much. Have a great day.
You too.
Bye. Thanks, ladies.
Thank you.